day-long waits in A&E, record numbers off work, sick, people pulling their own teeth out, 7 million on waiting lists, and ambulances for heart attacks and stroke victims that don't come on time. Just think about that for a second. Ambulances that don't come. Can any of you imagine losing someone in that way? I can't. And I mean that in every sense. I can't imagine it. It shouldn't be possible in our country, but it is. A cruel lottery of who lives and who dies that the NHS was founded to stop. And until now, until this point, for 75 years, it has. I don't think the NHS survives 5 more years of Tory government. And people say, oh, well, we've heard this before. The Labour Party is always saying it's time to save the NHS. But I say, look squarely in the eyes of the people who work in the NHS, who serve the NHS, and ask them. Speak to the working people who use the NHS, who depend on the NHS, who need the NHS. What do they say? And go to the people who believe in the NHS, love the NHS, but have been forced to buy the care they need from the private sector. Listen to them. No, at the next election, the NHS is on the line. The Conservative Party that's brought it to its knees will put it in the ground. But mark my words, if all we do in the Labour Party is to place the NHS on a pedestal and leave it there, that's not good enough either. We've got to fix the fundamentals, renew its purpose, make it fit for the future. To say to the British people, vote Labour, problem solved, would be an insult to everyone's intelligence. Patients can see how deep the problems go. My approach is different. It starts with the cause, the central project. How do we serve working people? And then it asks, what do we value? What do we conserve, cherish and protect? The answer, a public and universal health system, free at the point of use, paid for by general taxation, the NHS. The Tories underestimate the NHS, underestimate the bond between people and service, underestimate what you can do with a mission. That yes, people go to work in the NHS for a wage, of course they do, but also because they believe in something. This is how we go beyond the sticking plaster mindset, how we solve the crisis and tackle the long-term challenges. I want an NHS back on its feet. Of course I do. But I also want an NHS that's fit for the future.